Hello everyone, welcome to the episode 4 of MediShots. Previous videos I have discussed about the treatment and the pathophysiology of myocardial infarction and the cardiac biomarkers which are elevated during the occurrence of myocardial infarction. In this particular video, I will be covering the most important and mostly asked question in all of the competitive exams, that is the microscopic and gross features which occur in the cardiac tissue in the occurrence of myocardial infarction. We can see there are various time frames given in this table, and there are gross features, microscopic findings and electronic scope findings. Coming to the time frame from 0 to half an hour, there is no such gross feature, neither there is any light microscopic finding which is found. But when you see minutely in the electron microscope findings, you can see there is relaxation of myofibrils with glycogen loss and mitochondrial swelling. Coming to the irreversible injuries which occur from half an hour to 4 hours, there is usually waviness of fibers at borders of the cardiac tissue, and there is mitochondrial amorphous densities deposition. From 4 to 12 hours, there is occasional dark molting, the diagram of which I'll be showing you later on. In the light microscopic findings, there is beginning of coagulation necrosis with edema and hemorrhage. From 12 to 24 hours, there is dark molting. The tissue becomes dark and reddish in color with ongoing coagulation necrosis, picosis of nuclei, and hypereosinophilic appearance of myocytes. What is hypereosinophilic appearance? There is more number of eosinophils. Why do you see more number of eosinophils in the tissue? Because there is necrosis. The tissue is going under death, right? That is the reason. Then from 1 to 3 days, the dark molting has turned into yellow tan infarct, and coagulative necrosis is in its prominent stage with loss of nuclei and interstitial infiltrate of neutrophils. From 3 to 7 days, there is hyperemic border, central yellow tan softening, and there is beginning of disintegration of the dead myofibers which had undergone coagulative necrosis. From 7 to 10 days, you have maximum yellow tan with soft and tender red tan margins. Now the tissue starts to eat itself. It undergoes phagocytosis, which leads to tissue death. From 10 to 14 days, there is red, grayish, depressed infarct borders, and there is well established granulation tissue which can be seen. From 2 to 8 weeks, there is gray-white scar which is persistent throughout the cardiac tissue, and there is increased collagen deposition because all the steps of necrosis and phagocytosis is over right now. More than 2 months, there is a complete scar which can be prominently seen, and there is dense collagen deposition throughout the body of the cardiac tissue. Coming on to the dark molting which I had said, you can see the dark molting here. Here you can see the dark molting which is there on gross examination. It can be clearly seen. It is depicted by the green arrows you can see. This is the gross slide, and when you go to the granulation tissue with collagen deposition and neovascularization, this red black color arrow shows neovascularization, which you can see here, which is prominently seen, which is highly eosinophilic in nature. And coming on to these are a sequence of changes which occur in the first 24 hours. You can see there is eosinophilic infiltrate which is coming. Then you can see there is high number of eosinophils throughout the cardiac tissue, and then you can see the cardiac tissue undergoes phagocytosis. So these are the sequential changes which occur during the course of myocardial infarction. I have showed you the gross and the microscopic slides, both of them. Again saying, this is one of the most scoring and most important topic for any of the competitive exams. Thank you.